This week, it could mark the beginning of the end for COVID-19 in our country.
It is, there's a lot of hope this week, that's for sure. Today, more than 220,000 doses of the Pfizer and BioNTech COVID-19 vaccine could start to arrive here in Texas, here in Austin. Candy Rodriguez joining us live from the Dell Seton Medical Center at the University of Texas to explain how soon can we get this vaccine into the arms of healthcare workers, Candy?
Yeah, Sally, Tom, good morning. It could be as soon as the vaccines get here, and as you mentioned, that could be as early as today. This comes after the FDA gave the green light over the weekend to start the shipment of the vaccine across the country. And here in Texas, there are 109 hospitals, including Dell Seton Medical Center here, expected to receive those vaccines this first week of distribution for its healthcare workers who are first on the list to get the shot. This morning, the future looks a little brighter.
I think we're very excited that this is the light at the end of the tunnel.
Dr. David Lakey is one of more than a dozen healthcare professionals helping lead the way for the COVID-19 vaccine distribution in the state.
A lot of planning has been put into place so that they can very quickly start immunizing individuals.
Lakey says officials are working to secure logistics, from how hospitals will receive the vaccine to figuring out safe places to administer the shot.
All those things have to take place and be done right if we're going to go from this pizza box of vaccine that's arrived to actually having vaccine in people's arms.
Once ready to go, immunization will consist of 2 doses. The second dose of Pfizer's comes 21 days after the first, and some studies show the vaccine could begin to provide protection against COVID-19 just 10 days after the first shot.
Once we can get people immunized, we'll be able to get people back into society and see our loved ones and our family.
Later this week, Moderna is expected to go before the FDA. If cleared, healthcare leaders tell me we could start to see those vaccines roll out here in Texas as early as next week. Now, the answer to the big question, everyone wondering, when will this vaccine be widely available for the general public? And Lakey tells me that could happen sometime late next summer into early fall. Something else that's important to mention, Tom and Sally, we mentioned that some studies have shown that after the first dose, you could start to see some protection. But speaking with Lakey, he tells me it's important that everyone who's getting the vaccine gets both doses. That's how you will get the full effect and protection. Back to you.
All right, Candy Rodriguez for us this morning. Thank you, Candy. We also know the next batch of immunizations would go to those living in long-term care facilities and their caretakers.
They are vulnerable, so the vaccinations could start to happen before the end of the year in those facilities. Lakey, that you heard from in Candy's story there, says that hospitals plan to stagger the immunizations across departments. So, for example, they will not give the shot to every ER doctor on the same day, obviously, to ensure that they have enough people working in the ER in case some do have side effects, which do happen. They expect the side effects with this vaccine to be sore arms that will likely go away.
And we checked in with other hospital systems in our area. St. David's tells us it is expecting to receive the first shipment of the Pfizer vaccine early this week. Hospital employees who provide direct care to infected patients, they are going to be at the front of the line. Baylor Scott and White is telling us it will begin vaccinating frontline caregivers who've opted in as soon as this week as well. And it intends to accommodate every caregiver who's interested.
And the state's hospitalization is still going up. We're talking about more than 9,000 people fighting the virus inside hospitals right now all over the state of Texas. And it's so bad in Lubbock, there is no bed space anymore. If you take a look at that city's COVID-19 dashboard, the red block right there shows 0 beds left in that city. And right now there are 30 patients waiting for a bed, but only 30 beds available. It's a big problem that they're trying to figure out there in Lubbock.